Welcome to another episode of Med Madness, where we dive into crucial topics that every medical student needs to know. Today we're discussing cervical insufficiency, a condition that can have significant implications for pregnancy outcomes. Understanding this topic is essential for anyone involved in obstetrics and gynecology, as early recognition and management can greatly impact patient care. In this episode, we'll cover what cervical insufficiency is, its causes and risk factors, how it presents clinically, the methods used for diagnosis, and the management options available. We'll also look at a real-world case study to illustrate these points. Cervical insufficiency, also known as an incompetent cervix, is a condition where the cervix weakens and dilates prematurely during pregnancy, often leading to second trimester pregnancy loss. This structural weakness of the cervix can be caused by several factors, including collagen defects such as Ehlers-Danlos syndrome, uterine abnormalities like a septate or bicornuate uterus, previous cervical conization procedures, and past obstetric injuries. The pathophysiology involves a loss of cervical integrity, which fails to maintain its structural support against the increasing weight of the growing fetus, leading to painless dilation and eventually miscarriage or preterm birth. Next, let's discuss the symptoms and clinical presentation. Patients with cervical insufficiency typically present with mild symptoms, making early diagnosis challenging. Common signs include increased vaginal discharge due to the loss of the mucus plug, light vaginal bleeding as the cervix stretches, and a sense of pelvic pressure from the fetal parts distending the upper vagina. Clinically, the condition often reveals itself through painless cervical dilation detected during a routine examination or ultrasound, especially in patients with a history of second trimester pregnancy losses. Now, let's move on to the diagnosis. Diagnosing cervical insufficiency relies on a combination of patient history, physical examination, and imaging. Key diagnostic criteria include painless cervical dilation in the current pregnancy, a second trimester cervical length of 2.5 centimeters or less combined with a history of preterm delivery, and the occurrence of 2 or more consecutive painless second trimester losses. Ultrasound is a vital tool in measuring cervical length and identifying any cervical changes early in the pregnancy. Visible cervical dilation without uterine contractions is a clear clinical sign during physical examination. Next, let's talk about management and treatment. Management of cervical insufficiency primarily involves the use of cerclage, a surgical procedure where a suture is placed around the cervix to reinforce and add tensile strength. There are 2 main types of cerclage, prophylactic and rescue. Prophylactic cerclage is performed in the first trimester for patients with a history of cervical insufficiency to prevent recurrence. Rescue cerclage is applied during the current pregnancy when cervical changes are detected. It's important to note that if amniotic membranes are bulging or prolapsing, a rescue cerclage is generally not recommended due to the high risk of complications such as membrane rupture, infection, and imminent delivery. Other management strategies include close monitoring, bed rest, and in some cases the use of progesterone supplementation. To illustrate, let's consider a real-world case study. A 30-year-old woman with a history of 2 painless second trimester losses presents with mild pelvic pressure and increased vaginal discharge at 18 weeks gestation. On examination, her cervix is found to be 2 centimeters dilated without contractions. An ultrasound confirms a cervical length of 2.3 centimeters with no visible bulging membranes. Given her history and current presentation, a rescue cerclage is placed successfully, reinforcing her cervix and allowing her pregnancy to continue to term. The patient is closely monitored throughout the pregnancy, and she eventually delivers a healthy baby at 38 weeks gestation. In summary, cervical insufficiency is a critical condition to understand in obstetrics, given its impact on pregnancy outcomes. Early diagnosis and appropriate management, including the use of cerclage, can significantly improve chances of carrying a pregnancy to term. As always, the key to effective learning is engagement. We encourage you to take part in the pre- and post-podcast quizzes and review the related Anki flashcards to reinforce your understanding of this topic. Thank you for listening to Med Madness. Stay tuned for more insightful episodes.